Welcome, everybody, and thanks for joining. We'll probably have some more people join in the next few minutes, but I wanted to thank all of you for being here tonight and joining us for this inaugural initial web stream for Revive Strength and Wellness. As means of introduction, my name is Sanjay Shewakramani. I'm an emergency physician for UC Health at the University of Cincinnati. I'm also the medical director for the University of Cincinnati Westchester Hospital Emergency Department. In addition to everything, I am also a founding member of Revive Strength and Wellness, and very proud to say that. Joining me tonight is Jonathan Dix, who is also a founding member of Revive Strength and Wellness. Hi, John. Jonathan is also an emergency department nurse, and in addition to everything, father of two beautiful children and the husband of an amazingly supportive wife, Shirley. Anything else you want to talk about tonight, John, as ways of introduction?
No, I mean, you covered it. Absolutely. Currently, right now, I'm actually not practicing in the ER. I'm taking a bit of a sabbatical as I am an MSN candidate as a family nurse practitioner. So right now, I'm spending a lot of time in the clinical setting. Well, actually, not so much right now. All my clinicals down with the virus. So hopefully, I'll graduate this semester.
Fingers crossed for John. A few disclaimers before we start talking about everything. This live stream and the views expressed on it, even though I'm a UC physician, do not represent UC Health in any way. In addition, we're very early on in this pandemic. And again, I'm really appreciative of you guys being here, especially so early on. I know there are a lot of questions, and we're going to hope to answer a lot of your questions and provide some really good information tonight. But just know that this early on in any illness and any pandemic, there's still a lot to learn and things are changing day to day. So what we talk about today being April 3rd may change significantly by April 4th. So we appreciate you guys understanding that things are in flux, but again, we did want to provide you with as much up-to-date information as we can. Finally, we're going to do some broad strokes as far as approaching topics tonight. We're going to talk to you about your health and wellness in this setting. None of this is specific medical advice. So if there's anything that you're specifically concerned about when it comes to your health, please ask your doctor if anything concerns you about the health of you or your loved ones. A few guidelines for tonight. Everyone has started on mute tonight that has shown up. We're hoping you can keep it that way. Eventually, we are going to have a kind of Q&A session. We're going to hope to field a lot of questions from you, but for now, we've had a great turnout tonight, so I appreciate all of you being here. This is awesome, actually. So if you have any questions at any time during this, please open up your chat window. So if you basically go to the bottom of your screen on your computer and hit chat, that's going to open up a chat window to the right. While I'm talking, Jonathan will be reviewing and moderating the chat there. And then when he's talking, I'll do the same. And eventually we'll actually just go to a Q&A session. So please, any questions you have at all, type them in the chat window. I think it's possible on the phone as well. It just has to be activated. Final guideline for tonight, please be respectful. That is specifically, John and I can take beatings, but as far as everyone else in the chat tonight, please be respectful of everyone's views. We're obviously going through a pretty scary time right now, and we're just hoping that everyone can maintain respect for each other in any discussion that occurs. So you may be asking yourself, you are a gym, why are you hosting a talk on COVID? Well, I think the obvious answer may be, well, I'm a doctor and Jonathan's a nurse, so it kind of makes sense. But beyond that, we founded Revive Strength and Wellness. That is me, Jonathan, Steve, and Luke, who are also on this call and watching right now, with the understanding between the four of us that health and wellness isn't just about going to the gym and getting fit. It's certainly part of it, being fit, but there's so much more to feeling healthy and being healthy than that. There's a lot that can happen in our minds that can keep us from being healthy. Anything that weighs on us can hold us back, and no matter how much we work out, we're going to be ultimately unhappy and unhealthy if we don't address those. And what we've been noticing in the last few weeks is there's been a lot of fear and anxiety around this pandemic, and rightly so. This is a pretty scary time, maybe one of the scariest times in our nation that any of us has ever experienced. And the fear and anxiety that we've seen is, in my mind, at an all-time high that I've ever witnessed. And those feelings, they're okay. Everyone's going to have them, especially in scary times. Fear and anxiety have to, exist in order for us to survive, but sometimes they get a little out of control, and that's what we want to address tonight. Fear, we know, comes from not knowing things, not knowing details about things, and obviously in such a new situation, there's a lot out there and there's a lot we don't know. And again, my hope tonight is to address some of those gaps in knowledge of a lot of people around, and try to answer some questions that you may have and ease your fears. Jonathan's going to be more attacking that anxiety. Anxiety in us wells up whenever we just, when we feel like we don't have control. And we don't have a lot of control in this setting. There's a lot happening in the world right now, a lot happening around us that we're just unable to control, but there's a lot that we can control. And that will give us a better sense and less anxiety about what's happening around us. So that's what we're about, and that's what we're hoping to do tonight. Again, if you have any questions at all, please ask them in the chat window. I am not going to go into everything as far as COVID. There's a lot out there as far as scientific information, and the media is plastered with it. But what I wanted to address tonight is questions I keep hearing from people, concerns I keep hearing, and trying to answer those questions. So with that all being said, let's start. So one of the most common questions I hear is, how is it spread? COVID is spread, it's a virus, or coronavirus as it's commonly known as well, is a virus that's spread through droplets. So basically these little bits of fluid come flying out of your mouth if you're infected. You cough them or sneeze them, and they fly about 3 to 6 feet away from you. They then fall to the ground or land on an object, sometimes another person. So that's how someone spreads it. So how do you contract it? Well, if someone's coughed and you're within 3 to 6 feet of them and it hits you, specifically it goes in your eyes, your nose, or your mouth, specifically in your mucous membranes of your face, you can contract it. Now, coughing on someone directly is kind of a rare thing. Sneezing on them is also rare. Within 3 to 6 feet of someone, we're usually keeping our distance these days. So that's not the only way that COVID is going to spread. The other way it spreads, as opposed to direct person-to-person transmission, is getting on something. So say I'm in the grocery store and I touch a bag of chips, and then I put it down and someone else touches that bag of chips, it's on their hands. Now that person isn't infected with COVID. They have it on their hands, but they're not infected. It has to go from their hands to their mucous membranes, their eyes, their nose, or their mouth to get infected. So just because, again, you have it on your hands doesn't mean you have the infection. And there's a lot you can do to stop that whole process from happening, specifically from someone else's nose or mouth to an object, to your hand, to your face. Specifically, the most important things you can do then, and that gets to question number 2, is what can you do to keep yourself from getting infected, is to stop that transmission from another person to object to you. This is what leads to that whole thing of hand washing. You may hear of hand washing all the time and be told ad nauseum that you got to wash your hands, but the question may be why. Again, you don't get COVID unless you're coughed or sneezed on directly, which doesn't happen too much. Or if you carry something on your hand for a while, specifically the virus, and then touch your hand. Now, the cool thing about COVID is it's pretty weak outside of the body. It can be killed by soap, any alcohol containing fluid that's greater than 60 or 70% alcohol. That will kill it. So washing your hands is highly effective in getting rid of this, again, for 20 seconds at a time. And then cleaning surfaces. Again, I mentioned the bag of chips, but if you have a counter in your home that someone's touched, cleaning that. Now, the CDC has a great list of cleaning supplies, and I'll give you guys some links in a little bit that will lead you to the CDC and ODH websites, because they both have excellent resources that you can tap into for cleaning resources, what wipes are good, what are effective. And so again, I'll send you those links. Now, it's important, I skipped this before, but remember that just because someone isn't coughing or sneezing, that doesn't mean they don't have the infection. What we've learned about this infection, which is, you know, what's led to so much of this social distancing, is that people can spread this virus without having symptoms. That is, I might not be coughing or sneezing, but maybe I, you know, ate something and I, you know, left the virus on my spoon even though I wasn't having symptoms, and I shared that spoon with you. It can spread that way. And so as we've learned more about it, we know that virus can be shed days before people are even showing symptoms. So it's important to remember. And that's why we want to really keep our distance from everyone. John's going to talk about it more, I think, in a little bit, but you want to make sure you avoid touching your face. Again, you're carrying that virus on your hands potentially. It could be on your clothes. You touch your clothes and you touch your face. That's the way that virus is going to get to you. So you want to make sure you do that. And then I'll get to it in a little bit, but social distancing is one of the most important things all of us can do. And looking at everyone right now, everyone's doing a pretty great job of it. So thank you all. So I think everybody on this call right now, although we're going to publish this video eventually, but we all in Ohio, or almost all of us. There's a Canadian in this. Thanks, Joe. So a lot of us live in Ohio, and we may be thinking, why am I not seeing this? I keep seeing it on the news. I keep seeing it everywhere else. There's a lot of pandemonium going on in places. It's not affecting me. What is, you know, what's up with this? Two main factors, I think. You know, when things broke out in December in Wuhan, China, a lot of travelers left there and went to really populated cities: Seattle, New York, Chicago, New Orleans. We're seeing all of those in America. You know, and it wasn't just Wuhan, it was Italy, Iran, but people came to those cities and then things spread. It seems like not a lot of people came to the Ohio area, which is really great, because while those cities started to get infected, we had time to prepare. And in fact, because of Governor DeWine and Dr. Amy Acton's actions, when they started to see that spread, they started slowing it down. So I know it was pretty radical and it put a wrench in literally everybody's lives. But I believe that those actions were imperative to us not seeing that as badly as all these other cities are. And I think Ohio, again, Dr. Acton and Governor DeWine have done a fantastic job of this. Again, it has come with sacrifices to everyone's individual lives, but it's important. But that lack of travel into our city and also those actions have kept it. Now, I'm not saying it's going to stay away forever. In fact, we are seeing cases all the time. We're seeing more and more cases actually pop up in Ohio, and we don't think we're even close to the peak of this. Not to scare you, but it's going to keep coming for a while, but slowly. And that is the importance. Specifically, that's the importance of social distancing. So again, we're all doing a great job of it. You guys are, and our state is doing a very good job of it, much better than a lot of others. But really, by keeping 6 feet away from others and socially distancing ourselves, we're definitely seeing an effect, or we're probably seeing an effect. We don't know for sure, but I believe that it's slowing the spread. Which kind of goes to the question of, well, what's it really doing? Well, it's slowing the spread so that we don't have a spike. And that is the real goal of this whole thing. What we've all heard is flattening the curve. So if we don't socially distance ourselves, cities like New York, places like Italy that really got hit hard, you see a spike in cases. Now, all of those cases may spike in a few week period and then be done, as opposed to flattening the curve, which has less cases at one time, but spread out over a longer amount of time. In fact, we may have the same amount of people get infected as if we didn't socially distance. So you might say, well, what does it matter then? And I can speak from my own angle here in hospitals. I think we've all probably seen those videos from Italy, heard stories from Italy that are pretty concerning. I'll just give you a hypothetical. One day, 20 patients show up to an emergency department in Italy and say 10 need admission. Now, the thing that differs COVID from the flu or anything else we have seen recently is that it lasts for anywhere from 2 to 3 weeks, maybe longer. That is at least 3 times the length that influenza lasts, that the regular flu lasts, and at least 3 times the common cold. So these 10 patients have to get admitted to the hospital. Maybe some get placed on a ventilator. Well, the next day, another 10 come in. Now the hospital can deal with those, But these patients have to stay in the hospital for 2 or 3 weeks at a time, some of them on ventilators. And as the days pass, more and more people needing ventilators, we run out of resources in the hospital and we run out of space. So ventilators, you know, patients are on them for a long amount of time, and over time we can lose those ventilators. We run out. We're not anywhere close to that here in Ohio, but that's the fear, and that's what happened in Italy. Again, people had to choose who needed treatment, who they wanted to treat, and that is not a situation I ever want to be in my life. And so really slowing the spread, flattening the curve is one of the most imperative things we can do just to keep our hospitals under control and not having to choose who to treat. That's the main part of it. The other parts are that using that, you know, again, with overwhelming systems, you can also use up PPE or personal protective equipment. Again, you've probably seen it on the news. We're doing fine, most places in Ohio, but there are places that lose it because you have to use it so quickly with a lot of patients. Again, to keep ourselves protected and our patients protected, it's imperative that we kind of use as little as possible at once. And if we're overwhelmed with patients, we would run out quickly. And that's the other main reason. Next question. How many people are getting sick? That is a really tough question to answer. One main reason is we're not testing everybody, and no one's testing everybody. The other thing I've already mentioned is patients can be asymptomatic, but still carry the virus. And so we don't exactly know. What we do know is that at least 80% of people with COVID don't have severe symptoms. In fact, they have mild symptoms. That's what the data is showing right now. Now that can certainly change, but my anticipation would be that that number would actually go higher in time, just because there's so many patients and people that we're not checking right now for COVID, that the likelihood of you having a mild illness is pretty high. So rest assured, you know, if you get this, there is a good chance, a very good chance that you'll have a very mild illness. And I think that's what's scaring a lot of people, is that a lot of people think, you know, COVID equals intubation, being admitted for it, but it really doesn't, definitely. And that's one thing we have in our corner right now. Well, how do you know if you're sick? What are the symptoms? Again, this is a 2 to 3 week illness, which is much longer than the flu, the cold, or anything else we usually deal with. The most common symptoms are going to be fevers, cough, and muscle aches or myalgias. Those are the most common things, but we've seen it present, not to scare you too much, but in a very small minority of patients, just with some GI symptoms like vomiting or diarrhea, or even with generalized weakness. Those may all happen, but what we really worry about in these patients with COVID is shortness of breath, specifically low oxygen levels. That is the main thing we worry about, but there are other things that can get you, but that's one of those warning signs that we ask patients to look out for when they've been diagnosed with COVID. Not everyone has to get admitted. In fact, very few amount of patients with COVID have to get admitted. So when we do send them home, that's one of the main things we tell them to look out for. If you have any of those symptoms, I have to echo it again. I know it's probably said a lot, but the most important thing you can do if your symptoms are mild are just stay away from others, stay in your place, and try not to spread it to anyone else. I mentioned it before, we're not testing everybody, and the question is why? I can speak in general to Ohio. Right now, we're limited by the number of tests we can send physically, how many tests are available. Now that's subject to change. As you guys may have heard, there's some new testing come out of Massachusetts with added labs, but there will be more testing available in the future. It's just not now. And so we're restricted on who you can test. So even if you go to the hospital with symptoms, you're not guaranteed a test necessarily. It would depend on a lot of things. But I want to assure you guys that we are doing everything we can. You know, healthcare in America right now is doing what it can to fight this thing. The main things we're looking at is safety. That is the number one thing: safety for patients and safety for healthcare professionals, to make sure that we stay healthy and continue to be able to take care of our patients as they come in when they really need it. Protecting our patients, putting masks on them if they're symptomatic so they're not spreading it to others. We're also, again, personal protective equipment as much as needed in any case is what we're using. The other thing, and this is kind of broad, is that hospital systems everywhere are looking to increase their capacity. We don't want to end up in another Italy situation. We don't want to even end up where New York looks to potentially be going. And what I can say is it's amazing talking to other hospital systems and our very own, and that's the one I know most intimately. The innovation that's coming out of this to create areas for care is incredible. And know that your healthcare systems, especially here in Cincinnati, are doing everything we can to deal with this. And again, we've had time to plan this, and we continue to plan for as much as possible so that we can take care of you and your loved ones if you get sick. And I really hope you don't. A lot of questions right now and a lot of focus in the media about treatments. What can we do now? Why do people get sick is the real question. How do they get sick? Well, the COVID virus, the coronavirus, this one specifically causes a lot of problems in the lungs. It goes to the lungs and can cause viral pneumonia. And ultimately what that does is decrease your oxygen levels. So we treat this, the mainstay of treatment is what we call supportive. That is giving extra oxygen to those patients that have low oxygen levels, increasing their oxygen levels so that their body can function normally. Now, if that's real low, we may have to do something like putting them on a ventilator to give them extra oxygen. And again, that's the mainstay of treatment. Now, you've probably heard a lot about hydroxychloroquine and azithromycin as far as treatments. It's been in the news a lot. That has just, as of 4 days ago, gotten emergency approval from the FDA for use. Now, emergency approval doesn't mean the FDA says, yeah, this is a proven therapy, let's use it. It's more of a, it's all we got right now, and its risks are probably much outweighed by the benefits. And so it is being used in certain populations, but it is not for everyone, and we anticipate, or at least I personally anticipate, there will probably be shortages. So it's not something we can necessarily give to everyone, but it is something for hope, and we're just waiting for more data out. Most of the studies that we've seen on hydroxychloroquine and azithromycin have total patients that were evaluated of like 20 to 30 patients. We'd love to see a lot more data, but again, the initial data looks promising. There are a couple other treatments, including an antiviral medicine named remdesivir, which is being evaluated. And as you guys have probably heard, some vaccines are being explored as well. I just touched my face, sorry about that. I've been trying to be conscious about that, and of course it still happens. But vaccines are being evaluated. We won't know much about them until about a year or more passes. That's just a guess, but time will tell, and I'm hoping it's shorter. So what can you do to help? That's one of the main things I've gotten. There's been a ton of love from the community, including a lot of people on this call, about what can I do to help? The main thing is staying at home. And I know it's been brought up, but if you don't have to be outside your home, don't be. It sounds silly, I know, but I actually consider that heroic. This might be one of the most important things you guys do in your life, is staying at home. And I know it sounds crazy, but I am so grateful when I hear of someone tell me that they've stayed home all this time and they've come in as a patient because their symptoms got real bad or because something happened, but they've been staying at home. Like, nothing makes me happier from someone to hear that. To know that our community is doing what they've been asked to do, despite the sacrifices it takes in life, is incredible. So thank you to all of you for doing that. It's made our jobs a lot easier as we plan for this thing to continue on its way. Another thing you can do, again, if you're looking to help, we've received a ton of donations in our hospital system. It's been incredible as far as food and stuff. Also, PPE, masks, goggles. Again, we're not critically low. There have been some rumors about hospitals being out around here. That we're not there, but there's a chance we could get there. And so if you want to donate, if you have stuff, supplies, medically or anything like that, just send me a direct message on Instagram, or for those of you with my number, text me. My Instagram address is, or my name is Dr. Sanjay Sinsi, DRSANJAY should let you find me, and just send me a direct message, and we can do what we can to help. Again, Dr. Sanjay Sinsi. And then finally, the last thing you can do is really take care of yourselves and your loved ones as much as possible, as we all try to get through this together. So thank you for listening. I'm going to pass this along to Jonathan now, unless, Jonathan, were there any questions that came out from that?
Yeah, so just there was a question about so one of the attendees here has a daughter that's 6 with, sounds like, severe persistent asthma. So one of those kind of higher risk populations. But the question was, should there be more precaution taken for her since she has an underlying condition? My response to her was that, limiting known triggers are always going to be first and foremost the main thing. I mean, if she's allergic to dust, not put her in a dusty environment, or if there's mold or pollen, things like that to be careful for. If there's a comorbidity that's maybe associated with it as well, maybe diabetes or maybe poor wound healing, things like that. You really start to get in that scenario. Sanjay, I'll let you take the rest of that.
Yeah, I mean, great advice. So we know that there are certain at-risk populations, the elderly being one of them. Also patients, like you've mentioned, with chronic lung conditions such as asthma or COPD. We do worry more about those patients, and we ask you to take even more precautions than you normally would. Now, all of us should be taking precautions, but especially being extra safe with people with comorbid conditions. Again, lung conditions, but also there seems to be a link between high blood pressure and heart disease and not doing so well, and whether that's correlated just because of age or not, it's hard to know. Diabetes is also seen to be implicated, as well as obesity. Those are all risk factors, but lung concerns are also one of them.
Just to piggyback off that, I also mentioned, if she is in the green zone of, the asthma action plan, and anybody that has asthma kind of knows what the asthma action plan is. If it's well controlled within that green zone, I feel like it's okay to say that you're probably in the clear. The green zone of the asthma action plan just means that, he or she is adequately being treated, whether that's with, and if it's severe, she probably has not only the rescue inhaler, but also the daily dose of corticosteroid as well. So as long as those are keeping up and she doesn't need to have any higher doses, or you're finding that you're not having to use more and more. I mean, usually the same things that would bring you into the hospital with your child, the things that would concern you, are the same things that would probably bring you in. Don't shy away from going to the emergency department because of this, but at the same time too, make sure it's an emergency. And as mom or dad knows, with someone with severe asthma, that's an emergency. So never stay home just because you feel like you might be exposed to something. Because asthma attack will take you away much quicker than any COVID.
And Will had a question that you answered as well. So Will asked about how long will the virus survive on a surface, and it's an accurate answer as far as we know, John. A few hours up to several days. So there have been studies, and we're still learning more. Cardboard seems to hold it for a few hours. Stainless steel, maybe 2 to 3 days. So it can vary. There's a whole bunch of different surfaces that have been tested, but those are the ones that come to mind right now. So up to a few days. And anything like that, it can and should be disinfected.
So I guess it's a perfect opportunity to kind of start. It's really, really nice to meet everyone here. Some of you I know very, very well. Most I've never seen before. So the people that I can see on my camera, hi, it's very nice to meet you guys. I'm one of 4 of these incredible people here. That's starting, well, we're trying to start Revive. It is started. We haven't had our opening date yet, but it is coming. So we will be there. And so anybody that's being trained here by these 2 gentlemen below me, I don't know how it is on their screen. I give everything to those 2. These guys have been my mentors for quite a bit of time. I think I've known Steve probably the least, but quickly he's my favorite. So sorry, guys. So what I want to touch on is, I mean, we were hearing all these things that are hitting from kind of this outside world. We kind of feel like can I protect myself? What do I do if I get it? Oh my gosh, I'm going to get sick. There's a lot of doom and gloom that goes with this, but it doesn't have to be that way. Sanjay touched on the idea that you can be exposed, but will you get sick? You have a lot to say about this as far as what you're doing yourself, as far as kind of your daily habits and the daily things that you're doing. So for me, the one thing that I really wanted to touch on was, is kind of health and immunity in your immune system. That all stems from, and it always kind of comes back to the most basic building blocks of what you're putting into your body, and that's your diet, right? And so, oftentimes the question is asked is, what is the quote unquote healthy diet? And for many, it's a very difficult question to answer. I mean, there's no shortage of options, each one claiming to have the best efficacy, the best, you lose this much weight in this amount of time, feel this good in this amount of time. But at Revive, we really don't subscribe to a one-size-fits-all diet approach. That's not something for health as well. I mean, that's the same thing. But there are certain characteristics, and I think that's a better way to approach it, because everybody comes from a different worldview. Everybody comes from a different, health background, right? And so I don't want to sit here and say, well, the Paleolithic diet is the best, or the Nutrivore diet, or the Primal diet. All of them do have characteristics of really, really good diets. Those characteristics are always going to be, is it nutrient dense? Is it based in whole foods? And if you can say yes to those things, by proxy, you're eating a diet that's already an anti-inflammatory diet. The idea behind anti-inflammatory diets are that the whole foods are not the things that give you inflammation. More so, it's the preservatives, it's and what is a preservative, right? I mean, it's just the ability for somebody to make sure that their food stays on a shelf longer for you to get, right? It's nothing more than the ability to make more money. It's a profit-making ploy, and that's what it's supposed to do. And it works. It works really well for keeping baked beans, 8 years, and they're good to go. And I think a lot of times people, when all this is coming up, I don't know if anybody else had an experience with this going to the grocery store. Very odd for me, because I was actually doing pretty well because I shop in the periphery of the grocery store, right? That's where all the fresh things are. That's where the things that have the highest propensity to go bad are at. I'll kind of go in between every once in a while, but the idea, if you shop the periphery, you're doing pretty well. In a time like this, though, where there's some uncertainty, you've got people buying 200 rolls of toilet paper, even though COVID has 0 GI symptoms that I can think of. I haven't seen anybody having a problem with that. But it makes you do really goofy stuff. And so you stock up on all these things. But, if you can step back and look at what we're actually doing, you still have plenty of food that's really, really good, fresh food that's there. As long as you're washing your food, and as long as you're paying a mindful eye to what the sanitation regimen is of the place that you're getting it from, I think it's really smart. I was talking with Sanjay before. I think Costco has done a wonderful job of their sanitation and what they're doing as far as now limiting exposure, limiting the number of people that are going to be there. That's really important. But the idea that you don't have anything on the shelves is just kind of a myth, because if we're going for having a sound, calm mind here about what's actually going on, there are no food shortages whatsoever. The farmers unions, everybody has already said ad nauseum, we have enough food. All you need to do is not take all of it when it all gets there. So if everybody takes their little part and parcel, we're generally doing okay. So the things that kind of avoid that periphery of the shopping mall, what that doesn't have are a bunch of toxins, right? And so the idea here is that it's nutrient-dense food, anti-inflammatory, but you want to, avoid the toxic stuff. Just in the same way as you would, avoid on your food, the pesticides, the herbicides, the chemicals, as well as your skin, but also as far as kind of those hidden toxins, right? There's things like the unprocessed sugars, processed sugars, grains, trans and hydrogenated fats. Those are other, preservative-laden oils that are meant to be shelf-stable. That's the reason why they're so bad, because they do really, really odd things, so you don't want to have these kinds of things on board, right? So you then kind of turn to say, okay, I'm getting all these things, but how much am I supposed to take in? What am I supposed to do here? You just need to make sure that the nourishing, it needs to meet the individual needs of the person that's eating it. That's the best way that I can put it. If you don't do well with dairy, don't eat dairy, right? Just don't do it. If you have maybe celiac, or you're on that celiac side, and and wheat and gluten and things like that certainly kind of give you some stuff, kind of give you some GI stuff. Don't eat it. You know, your high quality diets, they need to prioritize the nutrient dense foods over processed food. It has to be that way. Because those nutrient dense foods, they have a whole wealth of wonderful ingredients in them, the micronutrients, the amino acids. There's about 40 different micronutrients that are needed for functional, normal function. And eating foods that are high in this nutrient density, they protect against these deficiencies and a lot of health-related problems. We at Revive, I think one of the things we say, I don't want to get into this idea of like saying whether or not one eating style is better, whether it's vegetarian or pescatarian, or if you're an omnivore. I'm going to kind of hit on all of it. And so as far as if you do eat animals, if you do eat meat, you want to make sure like beef, bison, lamb, pork, all those things, favor the grass-fed variants over anything else. So you want something that's grass-fed and hopefully grass-finished and pastured as well. And so all that means is that you've got happy animals that are living a happy life, animals that are processed through these big factories. It's incredible what they do and what they do to their bodies to get them ready to go to slaughterhouse, right? So they're pumped up with growth hormone to get them bigger, faster. They're given corn and soy products, which give them horrible gas and gut problems. And so you got to give them antibiotics to get those underlined as well. They're eating basically corn that has all sorts of horrible GMOs in them and all these things this feed corn is designed for nothing more than fattening a cow. And all that we found is that all those toxins and nutrients, all those toxins go one place, and it's right into the fat tissue. And so our idea here is that if you're going to be eating meat, you want to eat meat that's, hopefully locally sourced. That's another way to kind of do your part to kind of help give back to some of these essential workers that are still working right now to try to make sure that they can stay doing what they do that gives us everything that we need. As far as kind of shellfish, fish and shellfish, you want to favor, wild caught fish are probably best as far as shellfish are concerned. Farmed shellfish, really there isn't that much difference between how you would raise like a clam or an oyster versus in the wild. There's really not a lot of worry there in that. One of the big things about the shellfish is the important nutrient benefit of the iodine that's in there. It's wonderful for autoimmune diseases, and it's also really good just for kind of a tonic for the immune system, as well as a whole lot of good omega-3 fatty acids, most notably your EPA and your DHA. The EPA is called, if I can remember, I think it's called eicosapentaenoic acid, and DHA it's called docosahexaenoic acid. Those are incredible. They help balance the excess of the inflammatory omega-6 acids that are usually in a standard American diet that most people are eating. And just to kind of riff off a little bit, I'm saying these as a flawed person myself, okay? So, because I know right now that there's a lot of stress going on right now, and some people choose to turn to certain vices when times get really tough. For some people, it's alcohol. For some people, it's smoking. As an ER nurse, I saw a lot of people that turn towards the addictive qualities of drugs and alcohol, right? And you do it because you don't want to have to feel something that's giving you anxiety, right? And whatever that may be. And so it's really important right now just to recognize that and recognize that it's probably an irrational thought that you're having and maybe an irrational behavior, and it's not something that you're going to do the entire time. And as long as you understand that, it's not that big a deal, right? You can get out of those patterns, but the problem happens is when you start getting those ingrained patterns, and that addiction then becomes more than even the addiction. And that's what you don't want. And when we talk about that in terms of vices, if you talk about it in terms of food, that's where metabolic syndrome and obesity and all these things happen as well. I like to say to clients, eat an unlimited amount of produce. I really think it's very hard to get very fat on fruit. I do prefer maybe lower glycemic fruits if I had to choose. Things like berries, blackberries, raspberries, those are all wonderful fruits. They're low glycemic fruits. Blueberries are some of my favorite, but they have a really great antioxidant profile. And if you don't know what an antioxidant is, basically all that is a compound that basically fights inflammation, right? So you have that, you have this effect, and I think what we're seeing over time here is what I'm trying to show you guys is that if you can build a good building blocks of good food, you can really build your immune system so that you really don't have to rely on anything outside of that. Now, if you're sick, we want you to go to the hospital, but there are ways you can not get sick, right? As far as nuts and seeds, I love them. I really do love them all, save for probably peanuts. Those can be pretty allergic to a lot of people, and they have a pretty wonky fatty acid profile. They also have they can kind of carry some mold, right? So the way in which your peanuts are produced, very, very different. And so anything that's super, super mass produced, you got to be a little bit careful for, because there's kind of a clean way of finding it, and then there's a way that's maybe a little bit dirtier. Unhealthy cooking fats, you want to kind of get away from those, and those processed seeds, those seed oils, so the sunflower oil, the canola or corn oil, you favor for those. Maybe butter, grass-fed is always the best. I'm a big fan of Kerrygold butter. Right now, Kroger's has a sale at $3.19, pretty price. Normally, you probably pay like $5 for this stuff, but it's really, really great. It's a wonderful fat source. It's a wonderful source of energy as well. And we know that all the byproducts that come from animals, their milk, their butter, the better life that they have, the better profile that they have in their own fatty acids, the better products that they produce themselves as well. I always say stock up on spices. Some spices, if you're talking about cayenne pepper or like turmeric, coriander, some of these things, they actually have really, really good benefits for keeping your meat in a really good state. And it sounds a little bit odd saying that, but there's breakdown processes that can happen in the cooking process, and certain spices actually do a really good job of stopping that breakdown. Some of the acceptable plans, I don't know if anybody actually has a question about the acceptable plan, but I really, really like Whole30. I do it a lot with clients because it really is just a reset, a pullback for 30 days, and then you just kind of reassess. It is kind of like a deletion diet, right? You're taking out a lot of things, and I'm struck again by the person on the call that has their young one with severe asthma. One of the same things there with asthma, right? I mean, that's a severe immune response that can happen from asthma, right? And so you have to be very careful with the diets that you have somebody go on. So what you want to do with the Whole30 is you take all this stuff out, and then you start slowly adding things back in, finding out what you can tolerate and what you can't. That's where this individualized kind of process comes by. It's the same way we look at our clients with training individually and doing things for the client specifically. It's the same way that we would prescribe for eating as well. So like I said, so Whole30 ancestral type health diets, like the paleo diet, primal is another good one. The Nutrivore diet is another good one. Some guys that I follow, Mark Sisson and Chris Kresser, are two really, really good fountains of wonderful, wonderful knowledge. Chris Kresser is just this crazy dude that he's like, maybe, I don't know, I think he's like 65 or 70 now, but I mean, the guy looks like he's built out of steel. And basically all he does is just plays. He plays a lot, eats really well, and tries to reduce his stress as much as possible, and runs his life kind of by the primal mindset, right? Not to say that you guys have to go out with a stick and start, finding a buffalo and take it down, but it's the idea that you just want to get away from as much processed stuff and get it back to the most whole source item as possible. If you get it down to one ingredient, that's incredible. If you get it down to 5, that's really acceptable as well. So all these things, the diet in general, we're talking about just the bulletproofing of the immune system. The idea behind that, you have to, and that's why I started with the nutrition, is that you have to have the nutrition on point really before anything else goes. So getting, the harmful, items that are found in a standard American diet out that cause inflammation are some of the biggest things you can first do. The next is going to be, and I preach it all the time, it's just proper hand washing and proper hygiene in general. There's a very good podcast from a physician out of New York City that's right in the middle of it right now. And he posted this podcast, and he was like, look, I have without a doubt found the way and a positive correlation between people who are infected and the spread. And Sanjay touched on it, and we talked about it yesterday a lot. It's the touching of your face. So if you can get away from touching those three mucous membranes, meaning the eyes, nose, or mouth, you really, really do a good job of limiting any sort of exposure, right? If you're practicing good social distancing, if you're doing the right things, you're really, really lowering, very, very lowering the spread. Now, when you add in multiple, hand washing throughout the day, at least for 20 seconds, good mechanical hand washing to kind of get everything off. That's a really wonderful way to bulletproof yourself and really give yourself a lot of confidence. Go out and really be able to kind of interact and do things and not feel like, it's The Walking Dead, because I think some people kind of feel like if they go out, they're going to catch this and then they're going to give it to everybody. I myself, I have to be very careful about this. The three of the people here know that I have a very, very, very sick daughter that's 4 years old that has a very, very serious condition. And it's a rare disease. And, she's going to have it for life. And so she's in this category that's in that ultra, right? And so much so that my wife won't let me go back to the ER to make a little bit of cash right now because we don't want to spread any of that through. And and I can understand that. That is not irrational, right? It is irrational to walk out the door and think that I'm going to get COVID if I go to the store, or if you got to have to put some of the spirits aside and understand that you yourself, if you can do what you can at the house, then you're probably bulletproofing yourself enough to be just fine. I can't stress that enough. If you're very, very old, and have a bunch of comorbidities, or if you're in a red zone, those are the people that really, really, really need to be careful, okay? So take heart in that and know that you really are steering the ship right now, and you really have a lot of say in your health. I want to give that power back to our clients because I think right now a lot of things feel just completely out of their hands. As far as some immune boosting nutrients, with clients that I see in clinical a lot, I'm always telling them, really up your dose of vitamin C. If you can get a liposomal variant of it, it's just a more absorbed version of it. If somebody has liposomal, it doesn't mean it's any better or any worse. You need to take a little bit more of the oral route in the tablet form. But vitamin C for sure. Vitamins A and D, those are huge ones. They're both fat-soluble vitamins that are great for boosting the immune system. It's a little known fact, though, that they're only effective in preventing or reversing cold and flu when they're taken together. And one of the easiest ways that you can get vitamin A and vitamin D in a whole food source can either be from, fatty kind of fish. So like mackerel or sardines are really high in these as well. Cold water fish as well. But then also there's some really, really great supplements. There's extra virgin cod liver oil. Sounds pretty gross, but you can get tabs of it that you can swallow down. I myself don't really have a problem with it. I can take it down, no problem. There's certain flavorings that they'll put in it too, but it really does kind of, if you're taking it without the pill, drinking oil. It's not the most pleasant thing, but it is giving a lot of nutrient value back. So find a way, however you want to get it in there. Don't negate, the fish side of this and the omega-3s, versus the omega-6. As far as like selenium and zinc, those are huge ones. Zinc is another one. That's actually one of the protocols that's being put in with kind of this novel treatment right now. Zinc is one of the things they're actually adding in on the back end with chloroquinone and azithromycin. They're giving some zinc along with it because zinc is shown to actually prevent and disrupt viral replication kind of across the board. And so the idea is that you kind of hit this in a little different way. The azithromycin is really good because it kind of hits that opportunistic infection that Sanjay was talking about that kind of presents as maybe like double pneumonia, pneumonia in both lungs. A lot of those bugs that hang out in the lungs hate Z-Pak. They're really effective and you only take them for 5 days. So they work really well. But zinc in there is a nice one you can add in as well. I had spoke about iodine as well. If you can get kind of sea vegetables is what I call them, but kind of kelp is one of the really good ones. Nori paper has a lot of, so if you like sushi and you're eating it with nori paper, that's a good amount of iodine. A lot of health industry and, and in the health community, we've kind of pulled away from iodized salt. It's actually really important to get iodine in. And so that's a big area where you don't get enough now. And so it's something that you just want to make sure you're getting on board. Like I said, if you're eating a whole food source diet, you're hitting kind of all areas, you really don't need to worry about it. I said to Sanjay yesterday, as we were kind of talking about this and prepping, that that multivitamins are kind of funny to me a little bit, because if you're eating a really, really good whole source diet, a multivitamin is really there's not really much that it's doing. You're getting all that in a much more stable form, a much better package. Are there certain things that I think you should supplement with? We just went over a few of them there. You know, but I do think that if you can keep that diet as whole source as possible, the immune system is just gonna blossom. The things I definitely recommend, fresh ginger, especially in this time. If you can go to the store and just get I don't know if you've seen what fresh ginger looks like, but it almost looks like a finger that got mutated into spins off like this. And if you can get ginger on board, fresh ginger is one of the most incredible things that you can do. If I can find it, I made a recipe of it that I actually myself use. But you juice basically ginger, you put some honey in it, lime juice, and a few other things as well. And it's incredible. I mean, it knocks things down completely. And I mean, we're talking about peer-reviewed, research-based, random controlled trials that have looked at the efficacy of what ginger root can actually do. It's so cheap and so inexpensive. That kind of gets me into some of my other favorite things, kind of honey products, or bee products is what some people will call them, whether that be unpasteurized honey or royal jelly, bee pollen, and then one that I think is just really incredible. A lot of people don't know about it, but it's called propolis. It's Greek for, I believe, what was it called? The defender of the city is what it's Greek for. But I'll get into that. As far as honey, there's been really, and Sanjay will tell you, in the hospital, we actually use certain dressings that are actually coated with honey, a certain type of honey, but it has such a high amount of antiviral, antimicrobial, antifungal, all these properties of what it does is incredible, and actually is incredible for wound healing. And so much so that it's being used by all the wound care nurses that I know. They always have it in one of their packs when they come around. Back wounds, pressure ulcers, that I'll see in the ER as well. It's incredible, not only for the wounds, but also just for what it can do as far as for the upper respiratory tract. It's really, especially like buckwheat honey. If you can find buckwheat honey and have it raw and unpasteurized, if you can take that when you start getting a little cough, it's actually been shown in probably over 10 studies now that it's just as good, or if not better, than dextromethorphan, which is a cough suppressant that comes along with it with a lot of side effects as well. You got to think that a lot of these over-the-counter antihistamines and kind of things that dry you up, it's kind of counterintuitive to what we say as far as you want to be around humid air, especially when viruses are around, because you want that mucosal membrane in your nose to be nice and soft and wet, so that the hair and the cilia in there can get all that stuff out of the way, not dry and cracked and inviting these little tracks where, nosebleeds. It's just a direct entry right to the body. So it's really incredible. I really like propolis, though. I think just a story on actually what it is. If you look at a beehive, bees will put a strip of propolis going into the hive. That's the first thing they do, is they put a strip down. So it's like an antibacterial mat that all the bees go through, and when they go in, they got to crawl across this, and it sterilizes. You then extrapolate on that. Well, what do you do if like a rodent or something, or like a hornet gets in a nest, starts to steal the honey, and then they sting it and it dies, right? Well, now you've got this carcass in the middle of a nest, this gross necrotic carcass of a rat or whatever it is, right? And it's just dying there. Just like it would be in your house. If there was like a corpse in your house, everybody in the house would get sick, right? But what they do is they actually wrap the entire carcass in propolis. What it does is it sterilizes, and it basically mummifies the entire thing, and they go on with their day, right? So this antifungal property, the antimicrobial, and the anti-inflammatory properties of it, it's basically nature's antibiotic. And so Beekeeper's Natural, which is a good one that I back. And I really don't give a lot of recommendations out because there's not a lot of stuff that I think is worth it. But Beekeeper's Natural is an incredible company, and they actually make a propolis spray that you can use for yourself, but you can also use for your children as well. And there's a child version of it. I should say too that you really don't want to give honey products to any child that's under the age of 1, Like, I don't give this to my son. I probably can start, but he hasn't been sick, but he's just now 12 months old, right? So before that, I wouldn't have ever really decided to ever give him any of that stuff, just because you've got to be careful. After one, everything is usually just fine. There's no really a lot of anecdotal evidence to say that even or one, it's probably okay, but we want to always err on the side of caution with those that really don't have a voice for it, right? And then, I think that kind of the last 2 points that I really think to touch on is probably sleep, right? One of the most important things that you can do right now is keep yourself on a maintained sleep schedule. Steve and Luke preach about getting their 8 hours, and that's one of the things that I can tell you that I know that is one of their successes for themselves, is that they pay really close attention to those things that they know that they need to restore. Sleep is so restorative. We know now that there's a process in the body that happens with the cerebral spinal fluid, actually circulates through all the way through the spine, all the way up into the brain, and cleans plaques off. And you only get that when you hit that REM sleep, which is rapid eye movement, which is that deep, nice, restorative sleep. And that's what we're going for. It's really hard to do that sometimes when your mind is racing and all these things are going on because you're thinking about all of these what if scenarios with everything that's going on right now. It's one of the most important factors in maintaining good health, maintaining vibrant energy, and as well as a very strong immune system. As far as the last piece of the puzzle, you might think it's a little odd that the gym is not starting with exercise, but we're ending with it. But right now, exercise plays a very interesting role. And I think it's much different than the exercise routines that we would prescribe for our clients if everything was just fine and we were going about our normal days. But in these times of strain, we want to look at movement and the routine over kind of the personal records or the really involved movements, right? You want to do those things that allow you to kind of feel like you have some routine and some normalcy in your life. But you want to do it in a way that's still understanding the principles of what the trainers always say, right? You're always getting harped on with the movement and the form, right? So there's that mind-body connection that has to be there that we still want to be there. And if not even more, we want that even more right now because we do want you in tune with how you're dealing with things and how you're feeling. You want to lift weights for about 30 to 45 minutes, maybe longer, like 2 to 3 times a week. Everybody here, I think, I don't know if guys give me a thumbs up. Are there people here that are actually doing home workouts with you right now? Anybody that's doing them, thumbs up? Cool. Okay. Awesome. So, I'm kind of preaching to the choir here. So everybody that's doing these home workouts probably gets it. They know, and they're seeing the workout doesn't look exactly like they're doing it, right? It's not the normal stuff that they do, but still, man, they're having such incredible, this feeling that comes through. And from, my lips to your ears, I was talking to Luke just a couple of hours ago. He said that the thing that I am seeing so much with my clients, more so than I didn't think I was going to see, it's just how happy they are to do something again, just to move and to feel like they're doing something and getting themselves, up again and kind of getting back into that routine. That's one of the biggest things that we sit around together and we just obsess over is how do we make the client feel good still with all this that's going on, right? So the expectations are just different. We're not going to be prescribing, same things that you're going to see, but we are going to make sure that your heart rate's getting up there. We are going to make sure that you're moving, right? We are going to make sure that when you are moving, you're still keeping in mind those tenets that have been seeded, from the first time you met Luke or Steve, and the way in which they do their programs is a step fashion. It's that same way, right? You can't skip A to get to B and C, right? I think, to staying in that fat burning zone as far as, kind of the aerobic capacity is always a good thing. But then also with that too, take time for yourself to take some walks to get out of the house. I don't know if people are seeing this too, but on my street, I really never saw anybody on my street for quite a bit of time. We actually don't have any sidewalks where I'm at. But it is a back street. Now, all of a sudden, with this whole COVID thing going on, I'm seeing families in droves coming out and walking together. They got their dogs out. They're talking to each other. I actually know like half of my street's names now because they've come out of their houses and I can see them and I can say hi to them. I mean, I'm obviously not shaking anybody's hand or giving any hugs like that, but it's very interesting on how this whole horrible thing, this big negative, has really kind of reaffirmed to me how important your family is and how important your friends and the people that you support on, you rely on for strength through hard times. And I think a lot of us could say that we rely on these two here, Steve and Luke, and I do myself as well as Sanjay. You guys can all speak to this and attest to this. And while it's not the same thing that you're doing right now, the benefit of just getting your mind off of all these things that you can't control and back into a track on things that you absolutely can control, right? So beneficial. And I really think, and I really believe that a lot of people are going to come out of this better versions of themselves than they were before. And I think that's the ultimate goal here, right? The goal is not to just kind of survive this thing. You want to still thrive and be your best self, even when you feel like everything else around you is crumbling, right? Because that's just perception.
John, I'm going to cut in for a second here. I just want to share with you guys a personal kind of thing of what happened to me. So when things were kind of really exploding exactly a month ago, so early March, I basically started spending 16 hours a day in the hospital. That was spent time to prep, and I was doing everything I could. Now, looking back on it, I still think that was necessary, but I kind of got into this pattern of, oh my God, I have to be in the hospital as much as possible. And eventually we got to a point where I didn't have to be, but I didn't realize that. And I kind of got stuck in a rut. And it wasn't until I actually realized it because someone looked at me in the hospital and said, "What are you doing here?" And I was like, I don't know anymore, because the hard work, that front end work had been done, but it's so easy to get caught into patterns of behavior. And that's what happened to me. I was caught in this thing of, oh my God, I have to do. And I didn't realize I hadn't been taking care of myself. So I was eating really crappy. I wasn't sleeping well. And it was making that realization again, I kind of had to go through it, but then going back to what I used to do before, my habits in the morning, drinking plenty of water, meditating every morning, reading before I go to bed. I'm happy to share those habits with you guys that I do every day, eventually, or in another forum. But getting back into that so I could be my most productive self, because I could feel it slipping as well as my happiness. And I know most of us on this call know this, those things, exercise, diet, they really play a part, but it's easy to forget yourself personally when you're going through stress, when you have all this stuff piling on top of you. So just, take time for yourself. You're the most important person in your life. So just take care of yourself.
Heck yeah. I'll be brief. I know that it's one of the things is brevity. I have a problem with that. So I'll finish up here pretty quick. But, keep your mind challenged, whatever it is that kind of gives you that spark, do that. Read your puzzles, do those things that kind of give you that spice for life, right? Be inventive, be creative, be aware. And if you're not, if you're finding that you're not being stimulated, find time to read, write, play. Those are all really interesting things. Sanjay is learning how to play piano, and I think he's going to be a DJ here pretty soon. Incredible, right? So this guy, I don't know if he's good at any of it, but man, he's really, really taken his time to really find those things that he has a passion for and tackles them. You'd be surprised what idle hands do, right? I mean, when you're not doing anything, you get into some stupid stuff, right? I was telling Luke before, I don't know if anybody heard about John Jones, one of the UFC fighters. Said he was going stir crazy. So the guy got out, drank a whole bunch of vodka, and got in his car and started driving and shooting his gun in the air. Don't do that, right? But it's obviously what you can see is that, that's a really good indicator of really, really bad and really poor planning on his part and really bad stress reduction, right? So keep your mind challenged. Get outside. I think that's one of the most important things. Get your natural vitamin D levels up. You can try to get some of this good sun before it hits noon. When it kind of hits noon, that's when you really kind of get into some more of the damaging effects of the sun. When it's low and it's at that angle, it's really, really restorative for the body. So get out, get your cup of coffee or tea or whatever you're doing in the morning, whatever you're doing to give yourself that routine to get up, but change it a little bit. This time you don't have to get up and go outside to work. Some of us, you have to get up and just kind of get going with your day. So get out and get your face in the sun, get that vitamin D, and get those stress levels down. Vitamin D, as far as and stress are kind of counterintuitive. When it's higher, the stress is lower. When it's lower, the stress is And then, like Sanjay was saying, just practice some mindfulness as you can. I mean, I think the idea is that while our thoughts might not overturn the physiological circumstance of what's going on, we really, really underestimate the potential of reframing the experience that we're having. Okay, if that makes sense. And so with good choices and in addition to positive thinking, you maximize your capacity for an incredible vitality-filled life, you know, and it's our hope and our dream that we can be with you guys in a brick and mortar setting, you know, way, way, way after this is all said and done. And you can see kind of what we do here instead of just kind of giving you all the stuff to go home with. So really, really nice to meet everybody here. Sanjay, is there any questions that you want me to answer real quick?
None came up that I saw, but does anyone have any questions? I'm looking for a way to unmute all, and I can't. I can. I'm sure I can. I just don't know how. Anyone raise your hand if you have a question? Any other thoughts? Cool. Oh. So Erin and actually Stephen. Hey, Stephen. Stephen, her husband. So Erin has tasked herself. Erin is our clinical nurse leader in the Westchester Emergency Department, and one of my very great friends. So Erin has tasked herself with making this device. And I call it a device, but it's more of a plastic sheet. And it's something that basically one of the highest risk things we can do as emergency providers is stick someone down someone's airway. That's when those droplets turn into aerosolized droplets, and they fly a lot faster and further and through the normal masks. So intubating someone, sticking an airway down into their throat to their lungs so we can put them on a ventilator is dangerous. And so what she is doing is creating a plastic sheet that we can drape on top of a patient, essentially as a block. It's almost this rudimentary, like, little thing, but it can hopefully save lives of healthcare providers and then keep us from spreading it to others. Stephen is, I think that's PVC pipe, right? Yeah, PVC pipe to create a cage. So it's not just this like sheet on someone's face. So yeah, this is basic ingredients and probably costs what, 20, 30 bucks ish, less than that. So, you know, fairly cheap, but hopefully we'll save lives. So thank you, Erin, and Stephen, thank you for pitching. And Stephen's one of our physician assistants with the UC Health Group, so in the emergency department as well. So while they're not busy saving lives, they are playing with plastic and PVC pipe to save lives.
Go ahead, a brief question. Do homemade masks have any benefit? Absolutely.
They have some. It's hard to know exactly. They're not, you know, that surgical grade quality. We have a guest. They're not that surgical mask grade quality, but they could decrease. If you have nothing else, it's better than nothing.
Absolutely. Absolutely.
Anyone else? Okay, well, we hope that was helpful to you. Again, most importantly, take care of yourselves in this time. Do what you can, play your part. I'm always here. If you want to send me a DM, if you don't know me well, or contact me in any way, Zoom is my new best friend, along with this guy in front of me. So hope you guys all stay well and take care of yourselves.
Thanks, everybody.
Thank you, guys.